UnityPoint Health St. Luke's Hospital takes you inside the heart for a triple bypass open heart surgery in Cedar Rapids, Iowa. Our patient is Frederick. He's a 54-year-old Cedar Rapids man who had progressively struggled to catch his breath. Initially, he thought his asthma was gradually getting worse and went to an urgent care to get checked. Once there, the doctor looked at his chest x-ray and noticed his swollen legs and told him to go to the ER, as he suspected Frederick may have congestive heart failure. It was confirmed at St. Luke's ER, and Frederick received unexpected news. He would need triple bypass surgery.
I couldn't even go up a flight of steps because just being so short of breath. And I thought, well, we both thought it was asthma. And I was taking a couple different inhalers and wasn't getting any relief. So yeah, so this was quite a deviation off the highway going from asthma to open heart surgery. So that's kind of what led up to it, is the fact that I did shortness of breath and, had to sleep sitting up in my recliner. Couldn't eat much because I just felt like I was bloated the whole time because I retained so much fluid.
In the operating room is Dr. Garry Weide, a cardiothoracic surgeon from Physicians Clinic of Iowa, an anesthesiologist, a perfusionist who operates the heart and lung machine, a physician assistant, and St. Luke's highly skilled open heart team of nurses and surgical techs.
Most people with coronary disease or blocked arteries typically present with chest pain, and he surprisingly never had any chest pain. But for him, what ultimately happened was a slow progressive thing where the blood flow to the heart was reduced and the heart muscle just progressively got weaker and weaker and weaker because it wasn't nourished with the blood that it needed. So as the heart pump started to fatigue and fail, he started to build up a lot of fluid on his lungs and in his legs, and so that's how he developed congestive heart failure. So for him, it was more of a progressive, slow blockage thing as opposed to an acute, immediate thing, which we can see from time to time.
Congestive heart failure is a progressive condition which affects the functioning of the heart. It can be life-threatening if left untreated.
So for him, he's got what seems to be a reversible cause in the fact he's got coronary artery disease and blocked arteries. Some people, their heart failure is related to valvular disease. And if you correct the valvular problem or replace the valve, the heart muscle typically, if it's no longer subjected to the stress of either a faulty valve or abnormal or lack of blood flow, in time the heart muscle will ultimately recover. Now, some people, the heart failure is irreversible and it's damaged to the point that you can't fix it.
During open heart surgery, the heart is stopped and a heart and lung machine is used while the surgeon works on the stopped heart.
For us to be able to operate on a motionless, virtually bloodless field, we put them on cardiopulmonary bypass or heart-lung machine. So that requires us putting in big tubes or big cannulas into the heart that both drain blood and give blood back to the heart. And then ultimately what we do is we use a high potassium solution to cause the heart to stop. So the heart now is no longer beating, which allows us to work without the heart moving as we're trying to do things. During that time, we cool the patient so that the heart's protected, the brain's protected, the rest of the organs are protected. And then that gives us a chance to work for several minutes to try to get accomplished what we need to ultimately get done.
As the surgery gets underway, the patient's sternum or breastbone is cut to allow access to the heart.
The surgeon typically works on harvesting what's called the internal mammary artery off the front side of the chest plate. So it allows us to work kind of simultaneously so we can be productive and we can be efficient through the operations. The biggest part of coronary surgery or bypass surgery is you got to have conduit, whether it's arteries or veins. And so for us today, it was an artery from the chest plate and 2 veins from the leg.
The surgeon works in tandem with the physician assistant to harvest healthy blood vessels, which will be used to bypass the blocked area.
The harvesting of the vein in the left leg, historically, or many, many years ago, the way that was done is through a large open incision down the inside part of the leg, and you would take this, the greater saphenous vein out. And over the last, I would say 20, 25 years or so, techniques and equipment has been developed to basically make a small incision by the knee, and you have a camera with a little dissector on the end of it, and you can kind of tunnel it up and down the leg to basically clear the vein and free the vein up of the surrounding tissue, so ultimately just pull the vein out with only a small incision by the knee. And that's greatly improved, I think, patient comfort, patient satisfaction after surgery.
Once the surgery is complete, the heartbeat is restored and the patient is disconnected from the bypass machine.
When we're ready to start the heart again, as I mentioned, the heart's been cooled for a period of time and the heart's got a lot of potassium in it. So We give basically warm blood. We call it a hot shot. It's basically warm blood that's delivered directly to the heart. It does two things. One is it washes out any remaining potassium that's potentially circulating around the heart muscle itself. And the other thing it does is it warms the heart up. The heart doesn't like to be cold. If the heart's cold, it doesn't beat very well. So it does the ability to warm the heart up, wash the potassium out. So we take the clamp off. Ideally, you want the heart to start beating. Occasionally, the heart isn't quite ready to start beating again. And hearts that are sicker than normal, and in Scott's case, he's got kind of a sick heart, the heart can fibrillate, and so when the heart begins to fibrillate, we got to use these paddles to defibrillate or shock the heart to get it back into normal rhythm.
During the final step in today's procedure, wire is used to close the chest.
And when we're done, you just check everything, make sure everything's hemostatic, nothing's bleeding. Fortunately for Scott, everything seemed to be pretty secure, nothing was bleeding. And then closing of the chest, there's multiple ways to close the chest. The most common way to close it is with surgical stainless steel wires. And so for Scott, you got a combination of 7 wires in total, a combination of single and double wires. The double wires are just added for protective strength so the bone can heal back together. It takes typically about 8 weeks for the bone to heal, so those wires are designed to hold the edges of the chest bone together to allow the bone or the body's ability to heal it for its own strength for him.
Following surgery, Frederick spent 2 days in the intensive care unit and another 4 days at St. Luke's. He immediately felt a difference in his breathing. Frederick is participating in cardiac rehab and likes that it helps him know his limits as he works exercise back into his routine.
Just me trying to be overly aggressive, but I'm thinking I can handle more, maybe a couple more minutes going on the machines, or maybe a little more weight when I'm lifting it because I don't feel taxed. But then the nurse is telling me, well, you may not feel taxed, but that's not the muscles that you're working that may be taxed. So a lot of it's been education, basically just kind of relearning what I need to do. Plus, there's also this accountability factor too.
Frederick is already looking beyond his recovery to spending time outdoors, traveling to see his adult children, and catching a game at Wrigley. He's grateful for his care at St. Luke's, from the ER to the operating room to the nursing care.
Oh, I think it was exemplary. Everybody was always asking, well, what do you need? What could you use? That was down from the first-year students that came from Co to the ones that have been here probably 30 years. So everybody was going above and beyond, especially during this time of being so short-staffed.
UnityPoint Health St. Luke's Hospital is Cedar Rapids Heart Hospital, as the area's leader in open heart surgery since 1978. We invite you to learn more about our program and St. Luke's Heart Care Services today.
UnityPoint Health. Know how much you matter to this world.